Those who can no longer live on their own due to advanced age or chronic illness have several care options to choose from.
So we have independent living, which could be at a facility, but it's just separated where you just live in like an apartment. You can participate in other activities. Then there's also the assisted living. Could be in the same facility as independent, but that would require that you have a little bit of care. It can also range to full care at an assisted living. Then there is also memory care. That is if you have a memory diagnosis, Alzheimer's, dementia, and you would go to that special unit. And then there's also skilled nursing rehabs. That is a short-term place. So basically, if you were in the hospital, you weren't ready to get to home or to your assisted living, it would be an in-between.
Your health insurance might help pay for skilled nursing. The other options, however, are not covered.
There is a veterans benefit that if you are a veteran, but they will help pay for these either home care or facility. And then there's also, some people have long-term care insurance, which is like a life insurance that would have got years ago that will help pay. There is Medi-Cal, does pay a little bit for maybe an assisted living, but to find a facility that has a Medicare bed, like let's say they have 100 beds, maybe they have 5 Medicare beds.
Many opt to lower cost with home care, and statistics show that 90% of seniors prefer to stay at home as long as possible. It's important, however, to screen home care agencies carefully.
There is several things you should look for. One, we have to be licensed by the Home Care Bureau. So the state of California oversees what we do. Secondly, you should be having someone who is a W-2 employee come into your home, because then if anything happens to them, you're not liable. So if you have a 1099 contractor come out and they fall in your home, they can sue you personally. You should also make sure that they're fingerprint background checked and have a TB test, a COVID vaccine, and make sure they have all their PPE gear in place.
When a patient has a life-limiting illness that continues to progress despite treatment, it's time to bring in hospice care. Many are not familiar with this service, so when help is needed, it's hard to know where to start.
I'm here with Dr. Leslie Cochran, the Executive Medical Director for Hospice of the Valleys. Welcome. So please explain what hospice care is.
Yes, hospice care is a comprehensive type of care that's designed for patients and families when the patient has a life expectancy of less than 6 months. And it covers all aspects of care, from the medications, things like oxygen, medical supplies, more importantly, the human part of the care, which means you'll have a nurse at your bedside taking care of you, you'll have a doctor, you'll have social workers, spiritual care providers, and home health aides to provide services that the patient needs.
So what should people be looking at when they're selecting in-home hospice care?
That is a very important question. People need to know that they have a choice about selecting their hospice, and it's a very important choice. So I would strongly encourage that people do their research, and then they interview several different hospices. It's an important decision because these are people that are going to be in your home taking care of your loved one.
So who pays for this hospice care?
I'm privileged to work with Hospice of the Valleys, which is a nonprofit hospice, and we have funding available for patients who don't have insurance.
Oh, that's wonderful.
Whether you're looking for hospice or other types of long-term care, it's good to know there are plenty of options available, making the transition a little less stressful.